way that the vaccines work, as we talked about before, is that they trigger an immune reaction. And the way our body experiences an immune system activation, so our immune cells waking up, creating antibodies, is that sometimes we can experience some low-grade fevers, body aches, chills, headache, nausea, and particularly discomfort, pain, or swelling at the site of vaccination in the arm. But fortunately, these side effects last usually no longer than 3 days. If people have persistent side effects beyond that, oftentimes they might be related to something else, or might be related to actually a developing infection that someone was exposed to either before or around the time of vaccination. In terms of anaphylaxis, which is a severe, immediate immune reaction, or allergic reaction, I should say, to vaccination, the initial media reports of anaphylaxis to COVID-19 vaccination made it seem that they were very common, but in reality, the chance of someone having an anaphylaxis allergic reaction to a COVID-19 vaccine is about 1 in 200,000 people, whereas common things that we're more familiar with, food and penicillin, the chances of anaphylaxis to those is 1 in 2,500. And those are things that we commonly interact with on a regular basis as Americans, but it seemed that COVID-19 vaccination, because of a lot of the media scrutiny, made it seem that anaphylaxis occurred more commonly for COVID-19 vaccination, but that's in fact not what we have seen. And like I mentioned also, the VAERS, the Vaccine Adverse Event Reporting System, that allows us to keep really close track of any adverse reactions that people have to vaccination, so that if there were things that were missed in the earlier clinical trials that we now are able to see because of the billions of people who are receiving vaccine doses, we can detect them and we can report them with clear transparency to the public, so that everybody knows what the potential risks are for vaccination. There have also been some concerns about Guillain-Barré syndrome, which is almost an autoimmune neuropathy, so a dysfunction of nerves in the body because of an autoimmune reaction. This occurs in response to an infection. It may occur in response to vaccination, but there's actually been a lot of debate about whether or not vaccines themselves can cause Guillain-Barré, or an exposure around the time of vaccination where someone was exposed to an infection that actually caused it. There have been other vaccines that we have had authorized and approved for use in humans that have had an association with Guillain-Barré syndrome. And in fact, we have not seen any increased risk with Guillain-Barré syndrome with the COVID-19 vaccines than we have with any other vaccines that have been approved in the US. And in terms of long-term potential for complications or side effects from COVID-19 vaccination, as a general rule, it's actually incredibly rare for someone to have a long-term adverse reaction to a vaccine. The vast majority of adverse reactions that people will experience occur within hours to days after a vaccine, and that is where the VAERS system comes into play, so that we can keep surveillance on people for days, weeks, even months after they've had a vaccine. To date, we have actually not seen any long-term outcomes that have been reported that are adverse outcomes to COVID-19 vaccination. And we also have to keep in mind these vaccines have actually been around now for over a year, because they were used in human trial subjects back in June 2020. So we've had the benefit of observing people for over a year after vaccination, and we have not observed any long-term adverse outcomes thus far. And we also really don't have much data in previous vaccines in terms of other vaccines that have caused a long-term adverse effect. It's just not something we actually typically see with vaccination. In addition, there have been some concerns about blood clot formation in response to COVID-19 vaccination. And in fact, we have seen that the Johnson & Johnson vaccine might have an increased risk in certain blood clot formation in women who are under the age of 50, which is why there is a warning about that vaccine for that particular group of people, and why, in discussion with their primary care provider, they might opt for a different version of COVID-19 vaccination. But still, to put that in perspective, the number of people who have had a blood clot in response to the Johnson & Johnson vaccine is about 8 cases per million of people vaccinated. as compared to COVID-19 infection itself, where we see the same types of serious blood clots occur in 39 cases per million people infected with COVID-19 infection. So we're talking about at least a 5-time, if not 10-time higher risk of these blood clots forming in people in response to COVID-19 infection as compared to the vaccinations themselves.